Welcome to Image Bengal Healthcare. Today we are in Institute of Neuroscience of Kolkata and we got between us eminent neuro and spine surgeon Dr. Christopher Jarber. Today our topic is low back pain and its remedy. Welcome Dr. Garber in our program.
Good morning. Thank you for having me on your show. Please ask me some questions. I'm open to any.
Today the low back pain is increasing day by day. So what is the low back pain solution and how it can be cured?
Low back pain is a very common problem. It affects probably more than 90% of the population at some stage during their lives. Quite often it's just a simple muscle strain or spondylosis, and this can be cured with some exercises, painkillers if the pain is very severe, and some lifestyle adjustments, particularly looking after your posture, avoid prolonged sitting, and trying to keep your weight down. That usually cures most of the problems. Occasionally, at the extremes of age, that back pain can be a serious problem. Maybe there's some underlying disease like infection, or maybe kidney problems or liver problems, and very rarely it can be cancer or something like that, but that happens at the extremes of ages. Most commonly it's just due to spondylosis and doesn't require any form of surgery, just reassurance and some painkillers.
When should we go to the doctor for this type of problem?
Right. If the pain doesn't improve after a couple of days of simple painkillers like paracetamol, or the pain goes down one or both legs, or you have some urinary problems, or the pain is so severe it keeps you awake at night, and you have difficulty with walking, those are the times you should consult your doctor urgently. Otherwise, usually most pain settles within 1 week to 2 weeks, simple painkillers, and nothing needs to be done apart from some regular exercise.
Yes, sir. So, painkiller is a temporary relief. So, how long we can use it?
Painkillers, normally, if you take some simple over-the-counter medicines like paracetamol, usually the pain response should respond within 5 days to a week. If it lasts any longer than that, you should consult your doctor and maybe get fully assessed by him, maybe get an MRI scan, and maybe change your medicine, depending on the problem.
Yes. Sir, generally in this type of cases, we can't understand which doctor specialization we should choose. So whether we will go to orthopedic surgeon or we will go to the neurosurgeon.
Yeah, that's actually a very difficult question, and I think that what I would say is the fact that most, like simple low back pain can be treated by most doctors. But if the pain's more extensive or there's a possibility of surgery, then you should see a spine specialist, whether it's an orthopedic surgeon or a neurosurgeon.
What age is the problem of this disease?
It can happen. The commonest causes of the pain is spondylosis, and that can happen from any age from 15 to about 45, 50, 60. Anything outside of that, then it's what we call possibly a yellow flag symptom, which means that it should be taken more seriously. So if you're very young and have back pain below the age of 15, or you're very old over the age of 65 and have new back pain, then it should be taken more seriously.
Yes, sir. Sir, how to diagnose?
The best way of diagnosing is by an MRI scan, because that involves no irradiation. But I understand they're very expensive, or can be very expensive. So X-rays are sometimes done, but the MRI scan is the gold standard investigation.
Sir, how far medicine can solve this problem?
Yeah, I mean, 95% of cases can be cured with medicine and exercise and some reassurance without the need of any surgery.
Sir, in which case, without surgery, there is no option?
There are some situations, if there's maybe some infection or tumor in the spine where operation is necessary, or if the pain is persisting with leg pain, the patients can't walk, or difficulty with having passing urine, those are emergency cases and they need surgery.
So what is the risk of the surgery?
Any operation carries risks, but this is like a routine operation, and the risk overall is less than 1 or 2%, with like a 90-95% chance of cure.
Okay. Sir, you have said that complete cure is possible.
Yeah, cure is possible.
Okay, sir. Sir, is there any precaution or after the surgery?
After surgery, I mean, I think you need to take rest for about a month, which means avoid bending forward, lifting, avoid sitting on the floor for at least a month. But usually, after most operations, a month, 6 weeks after surgery, you're back to leading a normal life, doing everything.
Okay. Sir, how much weight is responsible for the back pain?
Most weight can be if you're grossly overweight, then back pain can be a factor in that. Because it also has other problems like knee arthritis and maybe diabetes and things like that. So I think it's best to keep your weight down as much as possible. So it is a factor, but the main factor is age-related and also because of posture.
Yes, sir. So what is the lifestyle and diet should be?
I think that everything should have a good, well-balanced diet. The back pain is increasing mainly because I think more and more people leading sedentary lives, spending a long time sitting at the offices. So particularly in the office, every hour or so, 45 minutes or an hour, you should get up and have a break for a couple of minutes and then do some exercise, then you can sit again. Avoid heavy lifting, avoid bending forward. Otherwise, there's no real restrictions.
Sir, is stress responsible for the back pain?
It can be. Stress, back pain is very complex, and I think different people react to different ways, and stress is a factor in that. So stress can make things much worse.
Okay. Sir, what is your suggestion to prevent a back pain for the young generation?
Young generation, a good, healthy life, no smoking, stop smoking, keep your weight down, do lots of exercise, and have a normal diet.
Okay. So thank you very much for your very good advice, and thank you, my audience. So if you have any question, please send it through our comment box, and please look at this channel. Please like, share, and subscribe. Till then, goodbye.